Hello, my name is Terapan. At this time, I will explain a little about phobia. So, what is a phobia? Phobia are excessive and unnatural fear of certain condition or object. People who have phobia can experience panic attack and excessive fear when faced with the source of the phobia. Phobia can be caused by several things, including traumatic event and unpleasant circumstances, a history of depression, anxiety, heredity, and the environment. And most people who have most people who have phobia realize that the fear the others is excessive and unreasonable, but they cannot control it. Phobia can cause disruption or activity to reduce quality of life. Phobia can occur at any age, but usually ever since childhood and adolescence. If not treated well, phobia can develop into an adult, and mostly women are having the phobia in their life than men. And some of the characteristics of people who have phobia are as follows. Number one, experiencing feeling of fear, anxiety, and panic when exposed to the source of the phobia. And number two, the phobia super actually relates that the fear is unreasonable and seems hard to fake or control the fear. And number three, feeling interestingly anxious when the situation or object you get or gets closer to them. That is physical closeness. And number four, the person with the phobia will do anything that they can to avoid the source of the phobia. Phobia caused by a variety of things based on the type of tears. Phobia divided into two types are specific phobia and complex phobia. Number one, specific phobia is a phobia of a specific object, animal, situation, or activity. For example, acrophobia. Acrophobia is fear of height. Hemophobia is fear of blood. Arachnophobia is fear of spider. Glossophobia is fear of speak of in front of people. And number two, complex phobia. Complex phobia usually develop in adulthood. To some level of phobia can interfere with daily activity. If you want to get rid of your phobia, you can take some therapeutic drugs or a combination of both. And how to deal with phobia? Actually, phobia can be cured, and usually people who suffer from certain phobia are aware of the situation. Pediatrics or psychologists usually will advise people with phobia to the behavioral therapy, drug consumption, or combination of both. The aims of doing the treatment are to help sufferers reduce fear of the source of the phobia and help support manage direction when faced with the search of the phobia. And that all the explanation of the phobia that I can be explained. Sorry for all of the mistake of pronouns. Hopefully the explanation is still clearly to understand. Thank you so much.